Hi, this is Dr. Jack Allergy. You can follow me on YouTube on my channel at Dr. Jack Allergy. That's DrJackAllergy. And on Instagram at hashtag Dr. Jack Allergy, all one word. If you like my videos, I would ask you to just click like. And if you have questions, please feel free to ask questions down in the comments section, as I would be more than happy to answer them as I'm able. I will eventually make videos on the most common questions so that I can get that out to a broader audience and have more to say. Today, I want to talk about the diagnosis of hay fever or allergies or seasonal allergies or even year-round allergies. So the diagnosis can happen. There are really three ways that we can diagnose allergies. And I'm going to talk about the least effective to the most effective manner that we do that. The least effective method is just by discussion. You come in, we talk, you tell me subjectively what seasons tend to be the problem. So if you say, Jack, I have issues in spring and fall, I start thinking of trees and weeds. I do try to be a little more specific and ask what specific months, as it can assist me even more. So if you say May through September, I start thinking of spring, summer, and maybe a little bit of fall. So trees, grasses, and weeds. So the least effective way to diagnose hay fever is by discussion. But, of course, we have to start somewhere. The next method that we can use is something called RAST, R-A-S-T, which now really is known as the immunocap, which is a blood test. So basically, we order specific blood tests looking at antibodies in your system, allergic antibody, to see what might come back positive. Blood testing is the next most effective, more compared to just talking about it, but some of the drawbacks are, number one, it takes a needle and sometimes a significant amount of blood for us to draw to get an answer. It takes up to 2 weeks to get an answer, and it's not as effective as skin testing itself. If we don't have any other options, we can use the blood testing. Additionally, if there are some questionable skin tests, we will sometimes go down the path of blood testing for hay fever and seasonal allergy pollens. Okay, so least effective is us just discussing it. The next most effective, moving in that direction, or next least effective, is blood testing. The most effective way to diagnose hay fever and seasonal allergies is with skin testing. And basically what this entails is us having you lie down, we clean your back, and we use usually a Sharpie marker or something just to mark it so we know which allergens we put in which location. We then use a skin test device. There are many different brands, and we put the allergens on your back. It feels like a little mosquito bite. It is not painful. Most people work themselves up more nervously than they actually need to be, because then when they're done, they go, wow, that was pretty simple and easy. But this is the most effective method because you get answers within 15 minutes. It is the most sensitive and most specific way to test in most cases, definitely the most sensitive. And it's nice because we know right away, you get your answers right away, and we can get a really good response to determine what is causing or what is contributing to your issues. Skin testing has been around for a very long time. It is very, very useful and very safe. If you are going to see an allergist, we recommend that you stop any antihistamine or allergy type medication at least 3 days or 72 hours before you're going to be seeing us, because what happens is that if we want to do a skin test on you, but you've taken your antihistamine or your allergy medications within the last 3 days or 72 hours, we might not get a response. And so it can lead to what we call false negatives, meaning that your skin's not reacting because of the medication in your system, not because you're not allergic. So try to stop your medications 3 days beforehand. If you're not sure about other medicines, call the allergist staff, and ask them, what medications can I continue and what should I stop? We should be sending you packets, so at least you have an idea of what medications to continue and what medications to stop. If you are going to see an allergist and they want to put more than 100 tests on your back, it is not an appropriate thing to do. That seems like they are just trying to increase their billing, and that is absolutely unnecessary. I personally, in my office, tend to do a maximum of 80 scratches on your back. That's for adults. For kids, I will do anywhere between 20 to 40, depending on how mature they are and how comfortable. We should not, and your doctor should not, be skin testing your child if they are less than 3. And they better be a mature 3. Otherwise, we are just torturing the child, and that is absolutely unnecessary. Plus, we're not getting a great answer because their immune system is still developing. So, there is no reason to skin test the really young. If we want to get just a baseline, sure. If you want to twist my arm, I'll do it. Or we can do a little bit of blood work when the child is getting other blood work, if necessary. Otherwise, we can still provide treatment and appropriate measures without torturing your child. Why make them hate the doctor any more than they're going to already when they're going to get their shots? Okay, diagnosis. Subjective, you tell us. We try to guess what it is. We try to postulate. Blood testing is the next. It's still not that effective. The most effective is skin testing. Don't take your medications at least 3 days before. This is Dr. Jack Allergy signing off. I will be following up with the treatment of hay fever, which I'm going to have to break up into different parts because there are a lot of treatments. Feel free to follow me, like me, subscribe. You can follow me on Dr. Jack Allergy at my YouTube channel that you're watching this, and on Instagram on Twitter at #Dr. Jack Allergy. All right, everybody, have a wonderful day.